Namaste viewers and welcome to Bend It Like LD. Today's video is a short practice on yoga for migraine. Now migraine, as we know, is just an intense form of the regular headache that one gets, but it can be quite painful because I know that a few of my friends undergo this every couple of months, and many a times it's accompanied not just with a headache but also with nausea, vomiting, throbbing pain, sensitivity to light, and in many cases they probably even have to rush to the emergency room or to the hospital to get an IV done or injection done. So yoga, of course, can certainly help in lowering the symptoms of migraine because it helps to bring about a balance in the autonomic nervous system and thereby reducing your heart rate, reducing the blood pressure, and bringing in that whole sense of calmness and peace to the body, reducing stress and tension, and releasing any knots in the body along the nerves as well. So today's practice, of course, is going to be completely restorative, and we'll begin, of course, with a very simple child's pose, and we'll speak about the triggers also as we proceed in this video. And this video actually can also be practiced, the sequence can be practiced for many other symptoms like insomnia, menstrual pain, perimenopausal symptoms, yoga for anxiety, yoga for panic attacks. So this is like a multitasking sequence, or how do you say it, a sequence that can work for many different issues. So let's get started. So sitting up in child's pose first by bringing the knees hip distance apart or mat distance apart. You will need a bolster for this practice most certainly, and 2 blocks. Now if you don't have a bolster, you can always grab like a really thick firm cushion, maybe 2 cushions if you need. Now bring that bolster all the way close to your groin and simply lie down on the bolster, wrap your arms around the bolster. So you make sure that during this entire practice there is absolutely no tension in any part of your body. So what I mean to say is that the effort should be minimal in the practice. Because it's a restorative practice, we are targeting the parasympathetic nervous system. So unless you are able to relax, unless you're able to slow down your breathing consciously, you will not get the benefit that you would get otherwise. So make sure you sit back, you relax, take your time with every pose. An ideal duration would be about 3 to 5 minutes per pose, so that you really allow the effect of the asana to seep into your body, to seep into your nervous system, to seep into that mental state, bringing about balance into your physical, mental, and emotional well-being. And from child's pose, we'll move to Sukhasana or Anahata Asana. It's called by different names. What I'm going to do is just going to keep a bolster under my chest and just rest my chest onto the bolster, extend my arms forward. So what we're trying to achieve here is to create some length in the spine. A lot of times we really do not know the triggers for migraine as such. For different people it could vary, but in general triggers are usually some kind of foods. Of course, that can be avoided, but many a times it could be stressful situations, any kind of tension, any kind of knot building up in the base of your neck, or it could just be as simple as too much heat or going out in the sun. So the first aim should be to really relax your back, relax the spine, and this pose really works well for that. So dropping your chest, extend the spine forward, wrap your arms around the bolster, keep pushing the hip back slightly towards the knees so that you feel a sense of lengthening in your spine and into your glutes as well. And from there, slowly, once you stay here and get stable in this pose, you can pull the bolster a little more back, drop the head onto the bolster. Again, dropping the head is very significant because we want to calm down, we want to close down, we want to shut down the activation in the body. So we are sending signals to the body to shut down. So it's a way to, activate the parasympathetic nervous system. Once you've rested here for about 3 to 5 minutes, slowly come to a short down dog and keep your knees bent. Again, no effort in the practice. So the idea is to not really trouble your hamstrings too much. So lift the heels up, bend the knees, and start to move the chest towards your thighs. So stay here for about 1 or 2 minutes and then step forward. Now we're going to do a ragdoll pose by just holding opposite elbows, bringing the upper body slowly down. Drop the head down like a dead weight. Slowly shift your weight towards your toes and gently swing your body from right to left. This swinging action also sends a signal to the body to calm down, to relax. Gently moving your body to the right and left. No keeping any tension in your head, no weight on your head. Drop your head like a dead weight. No tension in your shoulders, no tension in your arms. And from there, slowly release your fingertips to the mat. And we'll also give a gentle stretch to the body from here. So we'll press our right palm down. Straighten the left knee completely. And shift side. So press the left palm down, straighten the left knee completely. And keep the right knee soft. And then move to the other side. Press the right palm down, straighten the right knee completely. Bend the left knee softly, just to create some length in your hamstrings here. And from there we move to Ardha Uttanasana or Ardha Uttana by bringing your palms under your knees, slowly shifting our weight towards your toes and gently pulling the shoulder blades back so that you kind of move towards a flat back. Keeping the chin extended slightly. Again, the purpose is to create length in your spine, to create a little more space in your back, into your hamstrings. And slowly come up and give a gentle counter stretch by pushing your hip forward and stretching back. And release. And we'll move on to our next asana, Prasarita Padottanasana. So we're going to keep a bolster. Again, since it's a restorative practice, no effort in the practice. You will need blocks, you will need books. If you don't have blocks, grab 2 thick books which are heavily bound so that you can rest your head on it. So I'm adjusting the block here. So you can go ahead and adjust the block in any which ways that works for you, wherein you're able to keep your knees straight and drop your head onto the block. Again, the idea is to not put any pressure on the neck or the shoulders, simply placing the head on the block. Grab the block with both palms. So again, couple of options here. You can hold the bolster if you wish, or you can interlock your fingers around the block. Whatever works for you, whatever is comfortable to you at this point. And just allow the upper body to seep down, allow the upper body to hang down. Keep pressing the legs firmly, pushing the toes firmly into the mat. And just stay there. A micro bend or a soft bend in your knees is absolutely fine. And don't forget to breathe. The most important part in this whole exercise is to slow down your breath. So consciously taking slow inhalations, slower, deeper exhalations is very, very important. And while you're at it, while you're at these asanas, think about loving yourself, feeling good about yourself, releasing tension from your mind, releasing tension from the body. We do not have control over a lot of things in our life. So, working towards that state of mind, feeling a sense of neutral calmness. Maybe you can visualize your Ishta Devata or someone whom you look up to, like a guru, or anybody whom you look up to, anybody whom you kind of gravitate towards a higher consciousness, and feel a circle of protection around you while you're doing these postures. From there we move to Supta Virasana. So a couple of options I'll show you here. For those who are comfortable by bending your knees like this, place the bolster behind your hip and gently lie down on your bolster. I've shown you exactly how to do that. So your hips are still on the mat, but your lower back to your neck and your head is resting on the bolster. This is a great way to really send signal to the body to relax, and it's a very, very restorative pose as long as you don't get any knee pain or any ankle pain in this pose. Now, in case you feel that your body is not ready for this, I'm showing you another option here in Sukhasana, where you can simply cross your legs, move forward, pull the bolster, press the bolster against your lower back, keep the bolster firm and slowly lie down on your bolster. Dropping the head on the bolster, place your palms by the side. Now you realize the importance of having a thick bolster, because if you have a soft cushion, your body will not get that support. So it's really important to have a firm, thick bolster, and investing in a bolster, especially if you're prone to attacks like this, is I would think is a very sensible choice. And from there, slowly we can move to Supta Baddha Konasana by bringing the soles of our feet together. You can walk your heels a little away from your pelvis so that you allow the knees to gently flop down to the sides. Again, the focus is no effort in the practice, no pain in your groin, no pain in your inner thigh. So feel free to walk your heels front and back depending on how flexible your hip flexors are, how flexible you feel on that particular day. And I'm sure you'll start feeling a little sleepy, you'll start feeling very relaxed in this. You might want to just hit the bed after this, which is a great thing to do. Moving on to Upavishta Konasana, again with a bolster, a forward fold. So if you notice, there are a lot of forward folds, especially when you talk of restoration, because forward folds bring your heart closer to your belly. And that is again for activating your parasympathetic nervous system, where you're closing down your heart space. Signal to your body to shut down. Signal to your mind to close down any distracting thoughts. Release any tension from the body, from the mind. So again here, place blocks on the bolster, adjust it in any which ways that's comfortable to you. So I'm taking 2 blocks here, pressing my head on the bolster, on the block, wrapping my arms around the bolster, allowing my elbows to relax, allowing my legs to relax. Upper body is neutral, upper body is relaxed. And also practicing a sense of gratitude. Gratitude while you're in these asanas also goes a long way in feeling good. Feeling a sense of protection, feeling a sense of gratitude, loving yourself a lot more. Many a times we kind of tend to neglect ourselves, we kind of tend to neglect our emotions. So this is the time for you to be aware of what you're feeling. And give that time for yourself. It is very important in today's fast-paced life. It is important to keep that 20 minutes of practice for yourself. This is your time, your self-practice. And as I said, the sequence is common for many issues. If you're suffering from insomnia, if you're in your late 40s, if you're in your early 50s, in having those perimenopausal symptoms, if you've hit menopause and if you're having those menopausal symptoms as well, menstrual pain, all of these, insomnia, stress, anxiety, depression, all these issues you can use the sequence for addressing any of these issues. And from there, moving to Baddha Konasana by bringing the soles of your feet together, again walking your heels completely away from your pelvis. Keep a bolster on your heels and press it towards you and gently lie down on the bolster. And this is my room, and this is where many a times I practice, I fall, I fool around with my asanas. This is my sanctum, this is my sanctum sanctorum. This is the place I come to every single day whenever I want to feel more connected with myself. Staying here in every pose 3 to 5 minutes. Take your time with every posture. Find that sweet spot where you feel most relaxed and most comfortable. There is no right or wrong way to do this. It is your practice. And from there, lie down on your back. We'll do a viparita karni on the bolster. This has got to be one of my favorite go-to asana for almost so many things, like after a sport, after a run, after a long day. If I've been standing through the whole day, this is a great way to bring that blood supply all across your body. Viparita karni, so place the bolster under your hips, under your lower back, and simply press into the bolster, lift your legs up. Palms by the sides, eyes closed, and make sure that your eyes are closed throughout the practice. Keeping your eyes closed helps you to connect with yourself better. Slowing down your breath, staying here for 5 minutes, maybe even 10 minutes if you wish. Every time I get a little chance, a little time, I do this. I practice this a lot, almost every day in my daily routine. Reducing lactic acid in your body, improved flow of oxygen across the body. And slowly release your legs, and from there I think we are simply moving to Shavasana by keeping the bolster. Even the Shavasana here, if you see, is modified because I want the Shavasana to be really relaxed. So it's good to keep a bolster. The moment you elevate your knees, if there is any kind of soreness, any kind of pain on the knees, you can instantly feel a difference by elevating the position of your knees. So keeping the bolster under your knees, you can either relax in Supta Baddha Konasana by bringing the soles of your feet together, or you can simply separate your feet hip distance apart, flopping your feet to the sides and letting go of all tension in every part of your body and completely letting go into the mat. I hope you enjoyed this practice. I hope you find it beneficial. Of course, migraine requires not just the yoga practice, but of course, it's good for you to understand what are your triggers. Maybe for some it's cheese, for some people it's chocolate, for some people it could be ice cream. So find out what your triggers are, take a holistic approach to it, and I hope you'll be out of it very soon. Thank you very much. Namaste. Thank you for watching, and have a wonderful day.